I'm Christina. I'm going to be doing a head-to-toe assessment on you today while being videoed. This is for my class for Southern New Hampshire University. Ashley, she's going to be my volunteer today, so thank you so much for doing that. Now, are you okay with me assessing you as well as you being videotaped today?
Yes.
All right. So I've already closed the door for our privacy. I'm going to go ahead and disinfect my hands. I've already gone ahead and verified your full name and your date of birth. So first what I'm going to do is I'm going to assess your head, your skin, your nails. So I'm going to come behind you. I'm going to palpate your head. Just feeling for any sort of lumps, lesions. I'm also looking at your hair. It's very smooth, evenly distributed, so that's good. Coming around front, just looking at your skin, looking for anything that looks suspicious, lumps, bruises, just checking for your skin turgor, that you're elastic, your skin is warm, dry, intact. Looking at your legs, I'm going to look at your hands here, your nails, they're clear, translucent, they're smooth. Your texture throughout is even. I'm going to go ahead and check your cap refill, and that's 3+, which is completely normal. I'm going to do the same for your feet. I'm going to look at your toes. Your nails are smooth, translucent, they're clear, they're equal on both sides. Checking your cap refill, and they're 3+ on both sides as well. So now I'm going to go ahead and going to check your sinuses. So I'm going to palpate your frontal sinuses as well as your maxillary. Just looking for any tenderness. Any tenderness there?
No.
All right. So now I'm going to go ahead and just look at your nose. So I'm going to just kind of flash a little pen light, looking to make sure your nares, nothing obstructing, that they're equal, which they are. I'm going to go ahead and have you cover your left nose for me, your nostril, and just breathe in. Good. And do the same for your other side. Good. And it seems like you have no issues with obstruction. So now I'm going to test your cranial nerve 1, and that's with smell. So what I'm going to have you do is close your left nostril, and I'm going to have you tell me what you smell. And breathe in.
Vanilla.
Yes. And we're going to do that on the other side. And what do you smell?
Lemon.
Yes. All right. So now I'm going to go ahead and assess your eyes. So I'm going to go ahead and just palpate your eyelids. And do you have any tenderness there?
No.
Okay. So I'm going to go ahead and looking at your eyes, it looks as though your sclera is white, your irises are brown, your pupils are equal. I'm going to go ahead and shine this at the bridge of your nose, and this just checks your corneal light reflex, and you're symmetrical on both sides. I'm going to shine the light into both of your eyes, just checking for pupil reflex in reaction to light, which you have. Now I'm going to test your accommodation. So what that means is I'm just going to put the pen light out in front of you, and I'm going to have you look at it as I bring it to your nose, and I'm just looking for your eyes that they constrict, converge, and then I'm going to have you look straight ahead. Great. And they are symmetrical on both sides. So now I'm going to go ahead and check your extraocular movement. So once again, I have the pen light. I'm going to have you not move your head for me, and I'm going to have you follow the gaze of the pen light with your eyes. And I'm going to have you follow it in all 9 gazes. Great. And everything was smooth. So your pupils are round, reactive to light. They're equal and with accommodation as well. So now I'm going to go ahead and check your peripheral vision. So I'm going to have you go ahead and cover your right eye for me. Great. And I'll cover my left. And when you see the pen light, you just say now.
Now. Now.
go ahead and, if I had a Snellen chart, I would check your eye acuity. But since I don't, I'll just go ahead and explain what I would have done. And so I would have had you stand about 20 feet away from the chart. You would have told me what you could see, the smallest letters on the chart, and that would just compare to what somebody with 20/20 vision could see. So that's how I would do that. All right, so now I'm gonna go ahead and just look at your ears. And I'm just looking at the external, they look good, there's no drainage. You're even on both sides, symmetrical. I'm going to do a whisper test on you. That does check for cranial nerve 7. So I'm going to have you cover your right ear, and I'm going to whisper 2 words, and you tell me what I said.
Dog, ball.
Great. And the other side?
Cat, light.
Great. All right. So now I'm going to just check your facial expression. So that is actual cranial 7, where your hearing was cranial 8. So I'm going to have you raise your eyebrows for me. I'm going to have you frown. I'm going to have you squint your eyes. I'm going to pucker your cheeks. I'm going to have you smile. I'm going to have you frown. Great. All right. So now I'm just going to palpate your jaw joint. And this is your Chian-Che. Just looking for any tenderness. And I'm going to have you open your mouth. And I'm going to have you go side to side. Perfect. Was it tender at all?
No.
All right. So now I'm going to look at your mouth, okay? So I'm going to shine this pen light in your mouth. Good. Just looking at your oral mucosa, and it is pink and moist, and your dentition is good. I'm going to have you bring your tongue to the top of your mouth, to the bottom of your mouth, to the cheek, to the other cheek, and stick your tongue out and say ah. Great. All right. So if I were to check your gag reflex, which I'm not going to today, I would put a tongue depressor to the back of your throat, which would produce a gag reflex. But we're not doing that today.
Okay.
So now I'm going to go ahead and just check your lymph nodes here. So starting out in front of your ears, just going down your occipital, around your occipital, in front of your neck, along your clavicle, and then at your axillary nodes. All right. And I didn't feel any swelling, any nodules. Did you have any tenderness with that?
No.
No? All right, good. All right, so now what I'm going to do is just test your sensation to dullness and sharpness. So this is I'm going to test on you so you know what sensation's what. So this will be soft, and this will be sharp, okay? So I'm going to have you close your eyes for me. And I'm going to use this on your face, your arms, your legs, okay? You feel
Soft. Sharp. Soft. Sharp. Sharp. Soft. Soft. Sharp. Sharp. Soft. Sharp. Soft. Sharp. 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 Soft. Sharp. Soft.
good. Okay. Perfect. So now I'm going to go ahead and just assess your respiratory system. So I'm actually going to come behind you. And first what I'm going to do, yeah, if you can just twirl around for me, is test your chest expansion. So this will be on your posterior side. So I'm going to put both my hands on the back side of you, and I'm going to have you take a deep breath in. Great. And your chest expansion was equal on both sides. So now while I have you in this direction, I'm actually going to test your costovertebral angle, and that is by putting the flat of my hand and using a blunt percussion And this just checks for kidney tenderness. Did you have any tenderness there?
No.
All right. So now I'm just going to go ahead and assess your back for any discomfort, feeling along your spine. Any tenderness there?
No.
All right, and your skin looks good. So now what I'm going to have you do is I'm going to put both my palms on your back, and as I go down, I'm going to have you say the words 99.
99, 99, 99, 99, 99.
Great. And that just checks for fremitus, and that's just for lung volume density. So now I'm going to go ahead and percuss your lungs. Great. And I did not, and everything sounded normal with that. All right, so now I'm going to go ahead and listen. So first I'm going to have you take deep breaths for me. So as I move my stethoscope, if you'll take a deep breath. And just starting at the apex of your lungs and going down. And then I'm going to go ahead and have you say 99 as I am going down.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
All right, perfect. So your lungs were clear. I did not hear any adventitious sounds. And your vibrations on equal sides were equal. All right, now I'm going to come around front here. I am going to check your blood oxygen level. So I'm going to put this pulse oximeter on your finger. And really what I'm looking for is an O2 sat of 95 to 100. And you're 97%, so that's completely normal. And now I'm going to do the same. I'm just assessing your chest to make sure that you don't have any areas that might cause tenderness to begin with. And I'm going to go ahead and put the palms of my hands on your skin. And as I work down, I'm just going to have you say the words 99.
99, 99, 99, 99.
Perfect. All right, and now I'm going to go ahead and percuss these areas. And so now I'm going to have you take deep breaths once again for me. All right. And if you can say the word 99 as I move my stethoscope.
99, 99, 99, 99, 99, 99, 99, 99.
All right, perfect. All right, so now I've come to the cardiovascular part of the assessment. So I'm going to go ahead and listen to your heart sounds. I'm going to be listening not only with the diaphragm on my scope, but also the bell of my scope. So I'm going to go ahead and start on your right side. And this is second intercostal, and we're listening for the aortic valve. And now I'm listening to the pulmonic. Listening to the Erb's point. Listening to the tricuspid and the mitral valve. All right. fourth intercostal, and the mitral is the fifth intercostal mid-clavicular line. Okay, that all sounded good, normal. So what I'm going to have you do now is lie down for me. Great, and while you're laying down, I'm just going to go ahead and assess your jugular vein to see if you have any distension. So I'm going to have you go ahead and look to the left for me, because normally the jugular vein can be seen better on the right. So I'm going to have you turn to the left, to the right, and both sides. There's no jugular vein distension, so that's completely normal. All right, so now I'm going to go ahead and I'm just going to palpate your pulses. So starting at your temporal, okay, and palpating your carotids one at a time. They're normal. I'm going to go ahead and test your brachial, your radial, your femoral, your popliteal, your anterior tibialis, and then your dorsalis piece. Great. And those were all 3+. So now I'm going to go ahead and just listen. So first I'm listening to your temporal arteries. Good. All right. Now I'm going to listen to your tricuspid, and your mitral. Doing that with the valve. All right. So now I'm going to go ahead and listen to your vascular system. So using the bell, I'm going to go ahead and listen to your aortic artery, your renal artery, as well as your femoral. All right. So now I'm going to go ahead and have you turn on your left side for me. So once again, I'm going to go ahead and listen to your heart on this side. And first, what I'm going to do is I'm going to palpate for your the maximal impulse. Great. And that's the fifth intercostal mid-clavicular line where I feel that. All right, so that all sounded good, and I'm going to have you roll on your back now. All right, so now I'm just going to assess your abdomen. So normally, I would this would be under your clothes, but since you're wearing clothes, I'm just going to take a look. It looks like I don't see any abnormal movements, any sort of like fluid buildup. Your stomach is flat, symmetrical. So now I'm going to go ahead and just listen to your abdomen. So I'm going to start with your right lower quadrant. And normally I'd listen for about a minute to 5 minutes. And you've got normal active bowel sounds here. All right, so now I'm going to go ahead and percuss your abdomen. So I'm going to start at your lower quadrant. Just listening for tendency, which they all are. Now I'm just going to lightly palpate your abdomen and just, feeling around for if there's any masses, which I'm not feeling anything. Now to test your liver span, your liver being on your right side, I'm actually going to percuss from your third intercostal down until I hear dullness. Usually that's about the 5th intercostal. Now, I would normally mark a line there, and then kind of starting about your umbilicus, heading on up. I would also mark where I started to hear dullness, and that would be your liver span. Your spleen, which is on the left side, I would just be assessing if there was any sort of a splenomegaly. So I would percuss from the midline down along the costal margin all the way to the axillary line. And I did not hear any abnormal sounds with that. So if I were to do deep palpation for your kidneys, your spleen, as well as your liver as well, what I would do is I would use deep pressure, about 2 to 3 inches in, but I'm not going to do that today. So what I would do on your liver, I would pull on up, I would press my fingers kind of underneath where the vertebrae are, where the rib area is, and as you inhale, I would push down, and that would allow me, to feel if you had any sort of enlargement there. I would also do the same with the side of your spleen, where I would lift up and put my fingers on in with deep palpation to see if you had any spleen enlargement. And the same could be done with your kidneys. So, all right. So since you're in the laying down position, I'm actually going to go ahead and check your hip range of motion. So if you will bring your right leg straight on up for me, and that's extension, perfect. And I'm going to have you bring your left leg on up for me, great. And now I'm going to have you abduct your right leg, great. And then your left leg, great. And then I'm going to have you abduct, yep, and the other leg, perfect. All right, so now I'm going to check your strength. I'm going to have you push up on my hands for me. Perfect. And the other side. Perfect. And I'm going to have you raise your leg for me again. Yep, and push down. Perfect. And the other leg, and push down. Good. All right, so now I'm going to have you just sit on the side of the bed for me. All right, so now I'm going to go ahead and just check your range of motion. So if you bring your chin down to your chest for me, and on back to your backwards, and side to side of your shoulders. Yep. All right, and so now I'm gonna check the resistance of your head. So if you'll push towards me, great, and behind. And to the right. Great. All right. So now I'm going to check your strength of your shoulders. If you'll just lift up. Yeah. Okay. Perfect. So I'm going to test your range of motion of your shoulders. So if you can extend your arms for me, all the way up over your head. Great. And then all the way back in extension. Perfect. And then I'm going to have you go ahead and abduct for me. Great. All right. So now I'm going to have you go ahead with your arms, and from a supinate, I'm going to have you pronate and back to supinate. Good. That's great. Now I'm going to have you flex your arms, and I'm going to check your strength again. So push. Yep. And push against me. Perfect. Gonna check your wrists if you'll flex. Extend. Abduct. Abduct. Yep. I'm gonna do resistance on your wrist. So against me. Against me. Perfect. And now I'm gonna have you squeeze my fingers. Perfect. All right. Now I'm going to check your knees. If you can extend them for me. Yep. And flex. Yep. And just resist me. And resist me. If you can plantar flex your feet. Yep. And just dorsiflex. Perfect. And plantar. Dorsey. Great. All right. And resist me again. Great. All right. And I'm going to have you squeeze my fingers. Yep. And just dorsiflex. Perfect. And now I'm going to have you flex your arms. Yep. And push against me. Perfect. And now I'm going to have you squeeze my fingers. Great. All right. And resist me again. Great. All right. And test your deep tendon reflexes, okay? So, first I'm gonna go ahead and test your brachial. I'm gonna have you turn your arm like this. I'm gonna palpate for your tendon there. I'm gonna have you nice, relax with the arm, okay? Perfect. And just checking your reflexes here. And a normal would be about a 3+, which you are. So now testing your patellar reflexes. I'm going to start with this one. Great. This one. Good. All right. And now I'm going to check your Achilles reflex. Good. Good. Okay. And those were all 3+. So now I'm going to do just test what's called graphothesia. So I'm going to write a letter in your palm, and I'm just going to have you tell me what letter I drew in your palm. So I'm going to get your leg right. Perfect. B. Okay, your other hand. C. Great. Okay. So now what is called sterignosis. I'm going to go ahead and place an object in your hand, and I'm going to have you identify what the object is. So open your right hand for me, and coin, and open your left hand.
Pencil.
Yes. All right. All right. So now I'm going to we're going to just do your check your motor skills. So I'm going to have you take your right heel and bring it down your left shin. Yeah. And your to the other one, your left on your right shin. Great. And now what I'm going to do is have you close your eyes and use your hand of your right and place it on your nose. Okay. And now with your left. All right, perfect. So now I'm going to have you go ahead and stand up for me. And while you're standing, I'm actually just going to check your hip range of motion. So if you'll bend forward for me, and you'll bend backwards. Yep. And to your right, and to your left. All right, good. So now I'm just going to have you walk straight for me, normal. So I'm going to assess that. All right, and stop. And turn around for me. And then I'm going to have you do heel to toe for me and walk that way. All right, and you can stop and turn. And now I'm going to have you walk back on your toes. All right, great. And stop and turn and back on your heels. Great, perfect. All right, I'll have you take a seat again. All right, and so I'm gonna just check your memory real quick. I'm gonna check your cognition. If you could tell me your first name.
Ashley.
And where you are today.
Copley Hospital, Morrisville.
And what day of the week is it?
Saturday.
All right. And now could you tell me, long-term memory-wise, what you did on your birthday?
Went to Sarducci's.
Okay. So now I'm going to, for 20 seconds, I'm going to have you count from 100 backwards by sevens.
100, 93, 86, 79, 72, 65.
Okay, that's good. So now I'm going to say 4 words, and what I'm going to need you to do is to remember those for the next time that I ask you, okay? So it's going to be ocean, orange, mouse, and ball, okay? So now I'm going to have you count from 100 backwards by 20s.
100, 80, 60, 40, 20, 0.
Great. And now can you tell me those 4 words again?
Ocean, mouse, orange, ball.
All right. So now I'm going to have you, so now I'm going to have you follow the directions on this piece of paper for me. Perfect. And this is going to be the last test, and what I'm going to do is just test your balance. So I'm going to have you put your feet together for me. And for 20 seconds, I'm going to have you close your eyes, and we're going to check your balance. Great. Okay. Well, you were successful. We everything was normal with your assessment, so I did not find any abnormal findings. I want to thank you so much for volunteering for me today. As we talked about with our health assessment, I'm going to come up with a health promotion plan, which would include, nutrition as well as exercise plan. So we can talk about that in the future. But once again, thank you so much.